Hello, and welcome to the Strategy Project on Conflict Resolution. My name is Courtney Maxey, and my group members are Chinethia Davis and Magdalena Navarro. This is for the Professional Role Development in Advanced Nursing class at Arkansas State University. Our objectives for this project are to develop conflict resolution strategies for personal and professional development, and to analyze issues related to the implementation of conflict resolution in advanced practice nursing. What is conflict resolution? Conflict is competitive or opposing action of incompatibles, and conflict resolution is the informal or formal process that is used to find solutions. So in our conflict resolution analysis, we looked at causes of workplace conflict and found that communication, differing values, perceptions, and goals, and time management are common causes of workplace conflict. Common causes of conflict in healthcare are mental and emotional demands of having a stressful career, long working hours like working overnights or working overtime, fatigue, and then interacting with clients or patients who suffer from substance abuse or impaired judgment due to clinical diagnoses. The effects of conflict in the workplace include increased prevalence of burnout, decreased mental and physical health, increased work-to-family conflict, so those conflicts that occur at work and then are unresolved and are brought home to the family and cause conflict there, and then decreased job satisfaction and performance. So why is conflict resolution important? It's important because it can enhance team collaboration, so we have improved communication among healthcare professionals and foster a culture where different perspectives are listened to and acknowledged, which can develop stronger teamwork. Also for patient safety and quality of care, allowing employees to focus on patients and not conflicts happening between their coworkers. Conflict resolution is important for professional development. Conflict resolution skills are very important, especially to advanced practice nurses, and APNs who use conflict resolution will contribute positively to the advancement of nursing practice. Workplace satisfaction is also an effect of conflict resolution. So conflict resolution allows for a supportive work environment, contributes to increased job satisfaction, and fosters positive culture and increases staff retention. So what about role conflict? There is interprofessional role conflict, which mostly occurs between physicians and APRNs, but can occur between APRNs and ancillary staff, RNs and ancillary staff, etc., usually due to a historical hierarchy, overlapping roles. There can be some job competition there, and then economic competition with a vast pay grade difference. Intraprofessional role conflict is discord between members of the same profession, so APRNs and APRNs, RNs and RNs, etc. The major areas of these conflicts are going to be organizational, educational, in literature, and in clinical practice. Addressing these conflicts. Addressing interprofessional conflict. We want to promote interprofessional collaboration, working together. We want to facilitate the integration of new roles and clarify what those roles are. For intraprofessionals, we want to establish a rapport between those coworkers, have clear role development. We want solid orientation that allows these advanced practice nurses or nurses to be confident in what their role is, which furthermore can help with the cooperation and collaboration as a staff. We want to normalize conflict in a professional setting. We want to have open communication. We want to provide conflict resolution training. Leadership roles can get involved by establishing proper channels of conflict resolution, and then organizational policies should be put in place so that conflict resolution is an expectation, not just an added bonus, because we all know that conflict in the workplace is not an if situation, it's a when situation. So, methods of developing conflict resolution. We want to use different methods for this, so we can use a SWOT analysis. We can identify the strengths, weaknesses, opportunities, and threats that conflict can have. So we want to look at also what the strengths, weaknesses, opportunities, and threats of our staff, which can help us identify factors that can impact nursing practice. It can allow us to find what strengths we have, what our weaknesses are, and what potential conflicts we can address early on. We can set SMART goals. We can establish specific, measurable, relevant, and time-bound goals. These goals should be aligned with the mission and vision, providing clear direction for practice. So we want to find goals for conflict resolution. So what do we want to achieve by resolving this conflict? Do we need to set a time constraint on when this conflict should be resolved? We can utilize data and analytics. We want to leverage data and analytics to inform decision making. We want to collect and analyze relevant data to identify areas for improvement, so that we can make evidence-based adjustments to conflict resolution as we need to. We can promote interdisciplinary collaboration. So we want collaboration with other professionals, not just APRNs. We want to be able to work with physicians, therapists, social workers, and other clinicians in order to enhance patient care. And then we can embrace technology. We integrate technology into advanced nursing practice. One of the main problems of conflict is communication. And so we can use technology to enhance communication, streamline processes, and improve patient outcomes. We also want to advocate for policy changes. We want to engage in advocacy efforts to influence policy changes. We want to advocate for policies that support advanced nursing roles, and we want to advocate for policies that allow for conflict resolution to improve healthcare delivery. Then we also want to evaluate and adjust. We want to evaluate the effectiveness of our conflict resolution. We want to be open to feedback and willing to adjust our plan in order to resolve conflict in the best manner. So how is conflict resolution implemented? It can be implemented through educational programs and policy development. So we want to provide education on conflict resolution through healthcare professionals. This can be through workshops, online modules, or training sessions. And then for our policies, we want our policies to be established clearly and concisely. We want to know what steps to take when conflict arises, and then what resources are available. We can also implement conflict resolution through regular team meetings by providing a regular forum for open communication where team members feel free to discuss their concerns, share feedback, and collaborate with one another. We can also use mediation services if a conflict needs that. We can train individuals to serve as neutral mediators. This can be an HR individual, a nurse manager, or a nursing administrator, someone who has been trained to help neutralize conflict. We can also use feedback mechanisms. We can collect feedback on conflict resolution processes, regularly evaluate the effectiveness of our interventions, and then make adjustments as needed in order to resolve conflict. We can also use continuous evaluation to establish a system for conflict resolution processes. We want to monitor those key performance indicators. We want to set resolution for time conflicts, and then satisfaction of those involved. So in conclusion, ongoing training and skill development in conflict resolution are fundamental to creating a resilient, patient-centered, and positive healthcare environment. Conflicts are inevitable in dynamic healthcare settings, and investing in continuous training ensures that professionals are well equipped to address challenges, enhance collaboration, and uphold the highest standards of patient care.